I taught to you about pain relief using the power of your mind, because I had the most amazing opportunity to prove proof of concept today that I was not expecting whatsoever. So if you find yourself needing to divert your attention away from a pain, I'm going to go through the way that I used today, in actual fact, without any planning whatsoever, to show you just how easy it is to divert your attention away from pain. So for me, I had a trip to the dentist. I was going for not one but two fillings today. A very lucky boy, and I went in the room and I sat down on the chair, and she said, "Well, would you like anesthesia?" When I was a kid, I had far too many teeth. Far too many teeth. And so I was always in the dentist having teeth removed. I had overcrowding. And he started out by using the mask, okay, the anesthetic mask, the gas. And I despised this. I detested this. It was horrible. It scared me a lot, to the point where one day, I reckon I was probably about 10 years old, where I kicked the dentist, and I never had the mask of anesthesia after that. I ended up with a sort of a trauma, a sort of a phobia attached to going to the dentist, because I was there so often to have teeth taken out, and all of the paraphernalia that goes with that. It's not a pleasant thing that got habituated in my mind. So here we are today, going to the dentist, and she says, "Would you like anesthesia?" And I go, "Well, no, not really. You're the boss. You know better than I do if I need this." But I know in my mind that there are lots and lots of documented cases where people have used hypnosis as a substitute for anesthesia, right? Employing hypnosis was one of the methods by which, in actual fact, you can reduce down the level of anesthesia which is required. So here I am, I'm sat down in the dentist, and I go, "Well, go for it. Let's do it without anesthesia." And so what's important here is that I did not have any time whatsoever to plan. I didn't have 3 or 4 minutes to take in some good deep breaths, to allow my eyelids to close, to focus on my inner experience, to allow my body to become cataleptic, to go deep inside, to count myself down from 10 down to 0 until I've assured myself that I'm in a state of hypnosis. I haven't got time for any of that whatsoever. I'm already sat there. She says, "Right, let's go," and off we go. So let me tell you what I did, and let me tell you a little bit about the process which is involved. And then I would highly encourage you to investigate hypnosis, investigate the power of self-hypnosis, in actual fact, because it gives you a multifunctional toolbox. It gives you the ability to draw upon techniques and strengths that you already have, that are native to you, when you need them, like when someone's just about to drill into your tooth. So I find myself there, bang, she's already there. She's got the things in my mouth, and I closed my eyes, and I focused my attention on anywhere but there. Anywhere but there. And I have to say, when I'm doing this video, it's only 20 minutes ago that I had this done, right? There's no numbness whatsoever. So I know what she's doing. I trust her. So I place a narrative in my mind that I know there's stuff going on. I'm not stupid. I'm aware of the noises. I'm aware of the movement. I know that there's vibrations going on, but they do not bother me. That this is being done for my greater good, and that the only thing that's in my interest is to kind of get out of the way of all of this and let it proceed. And I do that by focusing my attention on a different part of my body, to focus intently on that, to the exclusion of everything else, whilst telling myself that I know there's stuff going on, but that it is in my best interest, that it doesn't bother me, and that everything is just occurring for my greater good. She finished, right? She finished. And at that moment, she explained to me that she had never once experienced that in her life. That there are people sometimes that say, "Yeah, I would rather we didn't do it with the anesthetic," but apparently, a couple of minutes down the line, they raise their hand and kind of say, "Actually, no, I would much prefer the anesthetic." And She also let me in on a secret that in actual fact she had to drill deeper than she thought that she would need to in advance. But she didn't tell me that at the time. So I was well aware of what was going on. It's not as if there's no mechanisms, feedback mechanisms to tell you what is going on. The only thing that I did was to comfortably delude myself, to choose to disregard that information in the moment, to focus my attention intently on something else, and to allow it to proceed so that she could do her job to the best of her ability and I was not getting in the way, sort of thing. And every so often, the thought would come back, okay? It's not as if you just turn into a zombie. The thought comes back. It's like, okay, I can feel something now. And as soon as that happens, right, so I know there's things going on, but they're not bothering me. And then I focus straight again on the other part of my body, and I focus intently on that. And I do that until the entire procedure is over. It's a fantastic, fantastic tool. And the sheer fact that it required zero ceremonies, zero paraphernalia to get me there, it was just a choice of the power of the attention of your mind. It tells you a lot. For me, this was the result of knowing that I already understood hypnosis. This was not the goal in itself. This was an application of something that I already knew. So if this is something that is of interest, what I would highly, highly recommend is that you learn self-hypnosis. If you find yourself getting anxious in advance of going to the dentist or going to the doctor or going to the hospital or whatever it may be, I'm not a doctor. I'm not going to tell you when it is important and when it is not for you to have anesthetic. What I am telling you is that this will give you a tool to deal with the thought processes that go on that can, when the medical professional gives you the opportunity, be used in a way which is useful for your greater good, for your benefit, right? I'm also not saying that it is necessarily recommended that you ignore pain. Okay, pain is a very useful mechanism to teach you that something needs to be dealt with. But if you're in the dentist, the pain is going to have no useful reason for being there. You're there at that moment in order to fix yourself. Yeah. So at that point, it's fantastic to have a toolbox that you can use to your benefit and to the benefit of the professional who's there to work on you without you kind of getting in the way. I hope that's of interest. Yeah. If it's something which is causing you a great deal of worry or concern, or there are pains which are kind of chronic that you need to find a way to deal with, I mean, you can contact me. I do free chats with anybody, and I can show you why and how this works, or investigate particularly self-hypnosis. But if you can investigate any aspect of hypnosis, what will result from that is a sense of greater self-assuredness when you find yourself in these circumstances. I can fall asleep for 12 hours on a plane now. This is just a sort of a fringe benefit that occurred through understanding the mechanisms of kind of quietening your body down. All right, thanks for watching, and until next time, subscribe. Take care. Bye.